Hello everybody. Today we are going to do discussions on Pedodontic MCQs part 2. Today we will discuss about some more MCQs from the topic child psychology and behavior management. So let's move to the first question. In managing a 7-year-old child, the dentist should keep in mind that a child at this age is option A frequently negative, option B susceptible to praise, option C generally uncooperative, and option D prone to separation anxiety. So the solution for this is option B susceptible to praise. Uh, so let's see how the answer is derived. So according to Erik Erikson, the stage of life is divided into 8, depending upon the internal crisis, which is defined by the turning points or the periods. So each stage demands resolution before the next stage can be satisfactorily negotiated. So stage 1 uh, ranges from age 0 to 1 year. This is stage of infant. So this is a in this stage the crisis is between trust versus mistrust. So in this, parents being the primary caretaker of the children, so if the kid is handled properly, he develops a trust with the world. So this stage, in this the very when we are talking about dental application, the very important point is when the dentist is treating the patient of this age criteria from 0 to 1 year, he must do it in front of the parent. So this has to be taken in consideration. Stage 2 is toddler, that is age 1 to 2 years. The kids who come under this age, they try to do the things independently. So the crisis is between autonomy versus doubt. So the how can a dentist use this stage, like making feel the child that he is doing the treatment independently, like dentist must obtain cooperation to make him believe the treatment is of his choice and not of the dentist or parent. So by doing this, he will cooperate more. Stage 3, early childhood, from age 2 to 6 years. So this age for most of the children. First visit to the dentist comes during this stage of initially. So this stage, they are very curious and try to learn many things, and they will explore many things. So in dentistry, this can be used by making the child explore the instruments that is used by the dentist, telling them and showing them what kind of instruments, what all used, so that to kindle the interest, and thus making them to involved in involved in the procedure, and that thus gaining their cooperation for the treatment. So now comes our question, stage 4, that is from age 6 to 12. So this is some kind of from elementary and middle school years. Children of this school, uh, they have the crisis between industry and versus inferiority. So they are more, these children at this most or at this stage are more likely to be motivated by abstract concept, and they are more attracted to be to praises. So they when so this can be used by giving them a reward or award or praising them, they feel good and they will cooperate for the treatment. So the question asked was, at which stage? So at the age of 7, they are more inclined to praise. So B is the solution for this question. So next comes stage 5, which is adolescence, from age 12 to 18. Uh, Here the positive and outcome is awareness of uniqueness of self, and negative outcome is inability to identify appropriate roles in life. So they will be like, their abstract concepts can be easily grasped, but things which impact on their personal health will be more impacted. Then stage 6 is young adulthood, which is from 19 to 40 years, and stage 7 middle adulthood from 40 to 65, and stage 8 is from late adulthood, which is 65 years to death. So other than knowing this, yeah, the important thing in this part is the stages and its respective criteria, like which is important and how it can be used by the dentist. So I think this question is clear. Let's move on to the next question. Reinforcement technique is based on option A, social learning, option B, Freudian psychoanalytical theory, option C, Skinner theory, option D, Meisler's theory. Solution is option C, social learning theory. This theory was proposed by Albert Bandura in 1963. Note this is very, very important. So, in this chapter, in child psychology, the theories and the scientist who has given them, this is very important and it's frequently asked question. So, in social learning theory, reinforcement is considered as a facilitative rather than necessary condition for learning. So, he believes that reinforcement is a very powerful method for regulating the performance of a behavior, but so an individual response in change to the reinforcement or extension of the previous action. Uh, Coming to the next question, aim of the first session with the child patient is to all except option A, establish general communication with the parent and the patient. Option B, start restorative procedures. Option C, obtain background information of the child. Option D, take a radiograph. So the solution of this question is option B. So the question, see the question well, it is accept. So accept, so you have to read the question carefully. So restorative procedure should not be started in the first dental visit. So what all can be started? So what all can be done in the first visit? So this is the tabular column which is given a nickel marva for the procedures that can be carried out during first dental visit. So just have a look of it. So what is first dental visit? This visit takes place when the child is around, when the first tooth around 6 years or something. So the first visit should be very friendly. Only if the environment is friendly and the dentist is friendly, the child will address us here and he will try to cooperate or he will adjust to the treatments. So first visits must be like introductory icebreakers to make child acquaint well with the dentist. So just see the procedures. So it must be like history taking, then normal radiograph taken must can be taken, and little clinical examination of both extraoral and intraoral conditions. Then to the parents, so what things can be done to the parents? We have to emphasize on toothbrushing techniques, and preventive treatments can be just emphasized, and then can inform regarding the number of appointments, what is the treatment plan, number of appointments needed for the particular condition, and the financial aspects for the treatment. This can be explained to the parent. And some simple procedures that can be carried out during the first dental visits are prophylaxis and topical fluid application, or any other non-traumatic procedures, like procedures without involving arrows, sounds, extractions. Those can be avoided. But if there is any emergency condition, that has to be treated. Question 4. The touch, taste, smell method of behavior management is usually used in children who are option A, deaf, option B, blind, option C, suffering from palsy, option D, suffering from Down syndrome. Solution B, deaf. So tell, show, do. I think everyone will be familiar by that technique. Tell, show, do is before starting a treatment. It is one of the behavior management. Before starting a treatment, the dentist can tell the patient, the child patient, that what is going to be done for the patient. Then he can show, like for example, if there is going to be a cavity and his patient and the doctor is going to excavate and fill it, he can just first explain it in a very simple terms, or using word substitutes, like if there is a tooth bug, there's some we are going to remove. Do not use any scary words like drilling, cutting, or something. Just remove with the we are going to remove the tooth bug. Then we are going to keep a medicine. So like this we can explain and can show. Tell the patient, then show what, then ask, then show the aorta, then make him see the make show him, and show with this nail bud you can just use the probe and you can make him feel it. Then how it is, how what kind of sharpness, those things we can make him to do, so that by doing this the patient will they'll cooperate better. So this is one kind of behavior management. But the question they are asking about touch, taste, or smell. So in a blind patient, as you know, tell, show, do cannot be used. You can use this technique: taste, smell. You can use the other sensations like touch, taste. So you may take the patient to touch, taste, or smell the particular material, and then you can proceed with the treatment. So other techniques we can use in these kind of patients are for can be seen here. So you can just relax for a blind patient, other visual or a visually impaired patients per child. These can be done. Introduce the other person, office persons very informally, make a physical contact, do so reassuring, holding the patient's hand often. So this promotes relaxation. Then allow the patient to wear eyeglass to keep them on or for protection and security. Then so use smaller quantities of dental materials, as strong taste may be rejected by visually impaired patients. uh, Limits patients dental care to one dentist whenever possible. So you audio cassette tapes and braille dental pamphlets explaining the specific dental procedures to supplement information and to decrease chat time can also be used. Okay, coming to next question. Which of the following can result in paradoxical excitement in children? Option A, morphine. Option B, phenobarbiton. Option C, nitrous oxide. Option C, amphetamine. Option D, excuse me, answer is solution B, phenobarbiton. So just go through the explanation, it's a self-explanatory. Barbiturates result in general CNS suppression by acting on GABA receptors. So phenobarbital is short-acting barbitons that are used in non-painful diagnostic studies. The dosage is 2.5 milligram per kilogram. Should produce deep sedation within 5 minutes and effect should last between 30 to 60 minutes. The side effect, potential side effect of phenobarbital is hypoxia and hypotension. Barbiturates can also cause paradoxical excitation. Next question. Apex of periodontic treatment triangle is. So the option A, mother, option B, child, option C, dentist, and option C, none. So this is periodontic treatment triangle in which this indicate. So what is periodic treatment triangle? This was first explained by Wright in 1975 and modified by McDonald in 2004. So what is periodontic triangle? Uh, the three people who are more very important in a periodontic treatment is depicted in this triangle. That is, for treating a child, both the family and the dental personnel are important, or their cooperation should be there to give a good treatment to the child. So child becomes the uh, at the tip. He is the focus, or he is apex of the periodic triangle. So there is a modified version of this periodic triangle given by McDonald, in which society also plays an important role. So question 7. Fear of closed spaces like dental clinics is called nyclophobia, zoophobia, xenophobia, and claustrophobia. Solution D, claustrophobia. So I have just shown the picture of other phobias. So just go through it, so that this may be also potential MCQs. Question 8. Which type of fear is most usually difficult to overcome? Long-standing objective fears, long-standing subjective fears, short-term objective fears, and short-term it must be a long-term subjective fears. So option B, it is long-standing subjective fears. So before answering this question, you must know what are subjective fears. Subjective fears, this is not caused by this is the fear that is being transferred to the child by imitation. So by observing or by hearing some other incidents or stories, the child himself imagines the fear. So this is called a subjective fears. So this kind of fears is more difficult to manage. Long standing, so they imitate this otherwise called imitative. This is otherwise called as imitative fears. This can be transmitted by display of the parent or by acquired by the child without being aware of it. So these are deeply seated and it is very very difficult to eradicate. So dentists should show a little more effort to handle this kind of patient who has subjective fears. Question number 9. Shy and the submissive child is a result of parents who are option A, overindulgent, option B, overprotective, option C, unaffectionate, and option D, empathetic. This is again a very important tableau column. The answer for this is solution B, overprotective. So this tab, go through this. This table tells you the impact of mother's attitude on the child's behavior. So what type of the mother's attitude, this impacts the child's behavior overall, and it impacts a child's dental clinic. So by you can judge the child's behavior by the mother's attitude. So by this you can get a clue how to treat the child. So just go through this. Okay. How is a 2-year-old kid positioned for an emergency examination of a fractured incisor? Option A on dental assistant lap, option B on a parent lap, option C on a dental chair, option D in a papo's board. Solution or solution B. So, parents lap. So, 2-year child is a little very less age. So, parents' presence is very important in this stage. So, while examining this kind of patients who come under this age criteria, parents should be available, and it is better to examine the patient by making him sit on the parent's lap, with dentist having knee to knee position with the parent, supporting the child that height cradle on the dentist's lap, and the parent can restrain the child gently, and then so the dentist has a good visualization. So since the psychological development under 30 to 36 months is insufficient to facilitate cooperation, so crying and fussing should not interfere with the examination. Okay. So the reference is from Dental Pulse, from textbook of Pedodontics by Shobha Tanton and by Nikhil Marwa. So I hope this session might be helpful for you. So